This short video explains the law of mass action and its importance in pharmacology. The law describes how molecules interact and bind based on their concentrations. In pharmacology, it helps explain how drugs produce biological effects, so understanding it is essential for interpreting dose-response relationships. Most drugs work by binding to specific proteins called receptors. This binding process is typically reversible, meaning the drug can attach and detach from the receptor. The interaction can be represented by a simple reaction, where a drug and receptor combine to form a drug-receptor complex. The law of mass action states that the rate of a chemical reaction is proportional to the concentration of the reactants. Applied to pharmacology, the likelihood of drug molecules binding to receptors increases as drug concentration increases. Eventually, the system reaches equilibrium, where binding and unbinding occur at equal rates. Two processes occur during drug-receptor interaction. Association is when the drug binds to the receptor. Dissociation is when the drug detaches from the receptor. At equilibrium, the rate of association equals the rate of dissociation, creating a stable proportion of occupied receptors. A key parameter derived from the law of mass action is the dissociation constant, or Kd. It represents the drug concentration required for half of the receptors to be occupied, and is the product of the concentrations of the drug and unbound receptors divided by the concentration of the drug-receptor complex. It provides a measure of the affinity of a drug for the receptor. A smaller Kd means that equilibrium occurs at a lower drug concentration. That occurs when the drug binds more tightly to the receptor, indicating higher affinity. The law of mass action is central to pharmacology. It provides the theoretical basis for understanding dose-response curves and receptor occupancy. Researchers use this principle when evaluating drug potency, affinity, and therapeutic effects. In summary, the law of mass action explains how drug concentration affects receptor binding. Drug-receptor interactions are usually reversible and reach equilibrium. This concept forms the foundation for many pharmacological models used in research and drug development.